Good morning, friends. I think sitting in the studio at the JP Nagar in Bengaluru, I actually get a feeling that I'm more like a news reader who has come out to actually give out some big piece of news, and so many people are actually watching to see what this is, more than a class. So I think most of you, all of you, are very matured and you've already done your post-graduation in your late 20s, some of you in your early 30s. So it's not necessary for me to just again keep reiterating what has happened and why there is a need to do a session like this. I think all of you very well know the new pattern of exam has been announced, and we basically don't take too much of advices at this point. I don't think any one of you would like me advising you too much. And I also, at your point, was somebody who never really wanted any sort of an advice from anyone. So we go straight into the matter as to how we can actually approach this whole thing. So when we have 150 questions with us, which are they're going to tell you, or they have said this are going to be at a PG exit level, let us try to just go back in history and see how we can put it into perspective. So 2015, 16, etc., before the original NEET SS came into being, we had these state-wise entrance exams, and at that point in time, the NAT board used to conduct a DNB All India Entrance Examination. So DNB All India Entrance Examination was different from the SS exam then, because we did not have a NEET SS. So we had institute exams, then Kerala entrance, Tamil Nadu entrance, Andhra entrance, etc., etc. And you were allowed to write only your entrance exam. I mean, suppose your nativity is in Kerala, you can write only Kerala entrance exam. Then few states like Maharashtra and West Bengal did allow everybody in the country to write the exam. So that was only for few states. And that's why the number of seats were far too less. And out of the seats that were in the state quota, most of them would be service, etc. And now this has changed. Now, when we go back and see that point in time, we can actually notice that the NAT board was conducting exams then. Those were the DNB exams, so DNB super-speciality exams. Every year they used to conduct 2 exams. And those 2 exams were of the same pattern like what they have announced now, that they had 180 questions then, and those 180 questions used to be from medicine. And that means that it would be medicine, just medicine, nothing else. So to write DNB, and I fortunately or unfortunately was ranked 2 in the country for that exam then, that exam basically had only medicine questions. Okay, but we generally never used to prepare for that exam, because those days people were like, we wanted to do DM itself. It was not like, okay, DNB chalega, that attitude was not there. Now, we wanted to do DM itself, but right now there is not much of a difference. It's all been equated. It's all the same now. And even in medical colleges, you can work these days, but then it was not so. Then I mean to 2015, 16, etc. So now what we have actually got to do is to see how NAT board did those 150 questions. So you could see that most of these questions were very basic. They were very normal standard. Few of them would be of a higher standard. So when we look at this 150 questions, what we do understand is that you're going to get questions from each of the chapters, cardio, neuro, nephro, endocrine, etc. And what can we actually do? How can we actually prepare in the remaining 2 months or 2.5 months? What can we actually do? What should be our strategy? This is the basic question. Now, as with NEET PG, let us try to dissect out chapter by chapter and see how we can approach each of the chapters. What from Marrow side we are going to do is, we are basically going to give you a few test series. We'll again come back to a few MCQ discussions. But before we actually go and see what we're going to give from Marrow side, let's see how we can approach this exam in total. So Harrison is basically what we consider as the Bible of postgraduate learning in medicine, which I basically don't believe in. And as you have seen from most of my videos, I have a personal feeling that I know things much better than how it is written in that book. And what is state of art is what that I have discussed during the course of my videos. And I think they stand definitely one step above what is actually written in that book. So I'm not going to question or maybe not criticize or anything, but let us try to understand topics as to how they are in total, in essential, and not just go and dig deep and read into the line and in between the line, etc., but understand it properly so that we don't miss anything. And we do MCQ sessions to basically put questions on certain one-liners which we may miss. Okay, so my perspective is that, okay, we're going to get around 90 to 95 questions which are going to be very simple, and another 55-60 questions which are going to be the rank determining questions. So let us go to the chapters. Chapter number 1, there's no particular order. Chapter number 1 that I want to discuss on is endocrinology and metabolism. So what should be your approach? Why I start off with endocrinology and metabolism is because this is the biggest chapter. Okay, if you take the whole Harrison, if you take any postgraduate textbook in medicine, the chapter that consumes maximum number of pages is endocrine and metabolism. Inside endocrine and metabolism, we have so many units. So let me just write down the name of the units first for you to get an idea. First of the units is pituitary. Second of the units is adrenal. Third of the units is diabetes. Fourth of the units is thyroid. Fifth of the units is bone mineral metabolism, and 6th of the units is gonadal disorders. Okay, so this is basically what is the toto. If you look at Harrison also or any of the textbooks, this is in toto. Let's try to see how we can approach this and learn. So let me start off with the first of the units, that is pituitary. So what do you have to be studying in pituitary? So I am taking my edition 5 videos as the base, or super specialty videos in medicine as the base, with which you can actually learn most of the things. As far as pituitary is concerned, I would expect you to know two things in detail. One is the anterior pituitary and the second is the posterior pituitary. Inside anterior pituitary, I want you to watch 3 modules. So the 3 modules would be the basic approach to anterior pituitary, including the anatomy of the pituitary gland, especially the relations and what happens if there is an enlargement, and the basic physiology questions and those things. Second is the module on prolactinoma, which of course is the most common pituitary tumor and of course very important, and of course linking into men and the others. And third is acromegaly, which again is a very, very hot topic. So basics, prolactinoma, acromegaly are the only 3 things which you can actually watch from the SS Medicine videos itself. And I think you have to be thorough with it because endocrine is very important, pituitary is very important inside that. When you go to posterior pituitary is all about 2 diseases, SIADH on one side and diabetes insipidus on the other side. So in fact, most of the questions on posterior pituitary are based on SIADH and diabetes insipidus, and also on this very important electrolyte abnormality called hyponatremia. So these are the 3 things that come under posterior pituitary. So when we have to study posterior pituitary, you can actually watch the SS Medicine videos, or if you are interested, I have done it under SS Nephrology also. You can actually see SS Nephrology under electrolyte and acid-base abnormalities. You can see this discussion on hyponatremia, and with that SIADH and diabetes insipidus. That's a slightly higher level discussion. This is a basic discussion. I feel these are the topics where you can get an edge. So if you have time, please do watch the SS part of it, or medicine part of it is also more than enough. But if you have time, please do watch the SS part of it. That's a recommendation from my side. So this is about pituitary. From pituitary, we go to adrenal gland. As far as adrenal gland is concerned, the 2 topics, one is the adrenal medulla and the second one is the adrenal cortex. As far as adrenal medulla is concerned, nothing to leave out, just watch the medicine videos. I've done it in detail. Please do watch FIO, MEN, MEON and PGA syndromes. Okay, so pheochromocytoma, MEN syndrome, MEON syndrome and polyglandular autoimmune syndromes. These are the things. Super specialty videos you need not watch in this. I think they're pretty much the same, so don't have to, maybe I'll tell you what you have to watch from the super specialty subject videos. Okay, so when I say my videos, I mean the super specialty medicine videos. I will emphasize on super specialty subject videos what you have to learn. That will be done, I mean, alongside this I'll tell you. So as far as pituitary is concerned, super specialty subject videos, I recommend you to learn SIADH, diabetes insipidus and hyponatremia if you do get time from my side, that is from the nephrology side where I have done it. Okay, and then medulla medicine is more than enough. Then when you come to adrenal cortex, it is all about 3 diseases. Okay, Addison, Conn's and Cushing's. Okay, Addison's, Conn's and Cushing's. When you actually look into Addison's, Conn's and Cushing's, again I think SS Medicine videos are more than enough. You can actually do it, and I think with that it should be done. Now here the SS videos, SS endocrine videos, which are done by Dr. Mayur and Dr. Nalini Wagmod. So from there, what are we supposed to watch? In pituitary, I think you can leave. If you don't watch it, is fine. As far as endo videos of adrenal gland are concerned, I would strongly recommend you to watch Mayur's discussion, which is MCQ discussion on the adrenal gland. It's a wonderful discussion. You can actually see it's a slightly more higher end discussion, but it's more MCQ based. You'll never find it boring. It's very, very interesting, and he discusses at a very, very fast pace, the pace that we need to learn things now. So I think it's a very good discussion. I have watched it personally and I liked it very much. So you can actually watch that. That is adrenal MCQ discussion videos. And from Nalini's routine learning videos, I want you to watch congenital adrenal hyperplasia, which is a very important hot topic in adrenal gland, which I think is better discussed by her. So it's more of a pediatric video also. So please go and watch that congenital adrenal hyperplasia. I think that should settle it. So that is about adrenal. From adrenal, we go to diabetes. As far as diabetes is concerned, I think my SS videos in medicine are more than enough. You can actually emphasize on, I would rather emphasize on classification, which you have to be knowing properly. Acute and chronic complications, okay? Acute and chronic complications, which has been done as a separate video. And then of course management, I think most of you might be knowing, but then few tips here and there about what to use this drug and one side effect of this drug, etc. That for that part you can actually watch this. Diabetes, if you want slightly higher and if you want an edge, because higher points are actually discussed again by Mayur in his MCQ videos under SS endocrine in diabetes, which is again optional, because inside that there are a lot of entities which are higher end, which you have to be careful. But Modi discussion I think is really good. So from there I would want you to actually be looking at Modi. I have also discussed Modi at a basic level, but Mayur has taken the Modi discussion to the next level. So that is probably a topic zone. So I probably want you to study this and maybe the MCQ discussion. That's more than enough. Then we go to topic number 4, that is bone and mineral metabolism. I think as far as bone and mineral metabolism are concerned, I would be, I think, more than happy if you learn my videos, because I think inside that most of the things have been covered, including calcium, phosphorus and magnesium metabolism. Almost everything has been done. From there, you have to watch Nalini Wagmot's videos on rickets. Okay, it's a very, very important topic which I have not covered. So rickets is something that you have to be looking from Nalini Wagmot's videos. It's very, very important. So calcium, phosphorus metabolism, magnesium metabolism, including hyperpara, hypopara, pseudo-hypopara, etc., have all been discussed by me in those 2-3 videos. You can actually get a good grip on it, and you can watch Nalini's videos for rickets. Please don't make the blunder of taking Harrison and underlining. Those key areas or key topic zones will not get into your mind. Okay, if you read now, you'll just forget, but when it actually is a kind of a class, then it sticks. And many of the things are not really great, many of the things are not updated, many of the things are wrong. So let us try to learn things how they are. So that is number 4. Number 5 is thyroid. As far as thyroid is concerned, I have done 2 basic modules on thyroid. First one is the basic approach and the anatomy of the gland and the basic stuff, and then including another module on hypo and hyperthyroidism and thyrotoxicosis and stuff. That would essentially cover Harrison, because everything in Harrison has been discussed inside that. Harrison's thyroid is basically a good one to read. So in contrast to pituitary, adrenal, bone and diabetes, where I felt that the book is really, really useless, thyroid is one topic where if you read, you do get a good understanding. It's well written. Now on top of this, I again want you to see the MCQ discussion part by Mayur, which is again very, very well done in thyroid. So you go to a next level in thyroid with Mayur's MCQ discussion videos. Again, it depends on your time. If you feel that you are short on time, you can skip. But I think people who feel that they need a bit of an edge, because it's finally that matters, it's still possible because you are having enough time. And most of you are like post MD, you can watch videos at a very, very fast pace. It's not like an undergraduate student who will take years to actually complete a chapter. It's not that way. You are a person who can learn very, very, very quickly. So this is about thyroid. Now, apart from this, what else if you're getting a PG level exit paper, as has been told by the NAT board, to get questions on gonads, reproductive endocrinology, etc., is not possible. So I think we can skip this chapter. Okay, completely skip this chapter. We can actually focus on pituitary, adrenal, thyroid, diabetes and bone mineral metabolism. I think with that, we can actually say goodbye to endocrinology. Miscellaneous topics, everything taken together at the end, I will do a video that's to be coming up. And inside that, if I feel something needs to be added, etc., we will add. But I think general routine endocrinology, this is more than enough. From the super speciality videos, what is that I need to watch? From the super speciality videos, you have to definitely watch rickets, as I have told you. From the super speciality videos, you have to watch congenital adrenal hyperplasia. From the super speciality videos, that is my videos, you can actually watch SIADH, diabetes insipidus. But remember, that is inside nephrology, where I have actually put it. Approach to hypokalemia, hyperkalemia comes under actually renal. That's why I'm not talking about it. Calcium, phosphorus, magnesium, everything you can watch from this. Osteoporosis is again another important topic which you can watch from Nalini Wagmot's videos under endocrine, where it is actually dealt in great detail. I have done osteoporosis, which is a basic Harrison level osteoporosis, but I think little bit more if you want, because it is a hot topic. Probably you can actually think about it. And then one more topic which I want you to watch from Nalini Wagmot's videos would be carcinoid and neuroendocrine tumors. Okay, carcinoid and neuroendocrine tumors, which I have not done. So carcinoid, neuroendocrine tumors, osteoporosis, SIADH, CH, rickets from speciality videos, and the others from the medicine part, I think should more than suffice. And there are so many other videos in medicine and endocrine that I have done, which I have not stressed on here, which you may skip. So pituitary, basically listen to the basic video, prolactinoma, acromegaly, and post-pituitary, SIADH, diabetes insipidus, and hyponatremia. When it comes to bone, calcium, phosphorus, magnesium metabolism, and hypoparathyroidism, diabetes classification, complication management. When it comes to adrenal, medulla, I told you, men-me-on PGA, Cushing adrenal, that is in adrenal cortex, and then of course thyroid, I told you the 2 videos. This is basically what is endocrine. Okay, from endocrine, we move to chapter number 2. Chapter number 2, again, with respect to the board exams, what I have felt in order of importance has been cardiology. So we'll just try to see how we can actually approach this chapter called cardiology. Let us see what can be done in cardiology. As far as cardiology goes, it's 100% damn sure that you are going to get questions on basic clinical cardiology. So there is no question on that. As far as basic clinical cardiology is concerned, in edition 5 and in the NEET SS Medicine part, you can see my videos on pulse, JVP, heart sounds. Okay, pulse, JVP, heart sounds and murmurs. So these are 4 videos which I want you to strongly watch. Okay, strongly watch. Now, having watched this, there are 4 videos on AS, AR, MS and MR. Okay, 4 videos on AS, AR, MS and MR. Now, NEET SS cardiology videos you can actually watch by Dr. Nishant, where he has discussed AS, AR, MS and MR, the conceptual part of it in a great detail fashion. And that's actually really good and really interesting, because if you watch that, you get an edge. Okay, my discussion is the basic AS, AR, MS, MR part. If you want, you can actually go for that extra edge. With that, you can club all these things and study. Okay, so here I would probably want you to watch NEET SS cardio videos, especially NEET SS cardio videos on AS and MR. Okay, they are excellent. Okay, they're just about excellent. So NEET SS cardio videos by Dr. Nishad on AS and MR. I think the rest of the things should be sufficient. Now there are very important conceptual classification type of things. One is chronic constrictive pericarditis versus cardiac tamponade, which I have done in detail. I think that should be more than enough. I think with that you will get a basic idea. Second is dilated cardiomyopathy versus hypertrophic cardiomyopathy versus restrictive cardiomyopathy, of which hypertrophic cardiomyopathy very important, and I want you to watch hypertrophic cardiomyopathy again from NEET SS cardiology videos by Dr. Nishad. Is actually done in great detail and it's a wonderful discussion where I think your concepts on hypertrophic cardiomyopathy will stick like that for your life. You will never forget. So in fact it does open up a lot of things to actually learn. Then heart failure with reduced DF and heart failure with preserved DF. I think a very basic discussion that I have done should be more than enough. Nothing more needs to be done. CCP, cardiac tamponade, hypertrophic cardiomyopathy are very important exam topics. Then comes infective endocarditis. Infective endocarditis, I have done a basic discussion, a Harrison level discussion in the infection part. Nishant has done a more detailed discussion of infective endocarditis. I think both are more or less the same, but Nishant has gone into a little bit more practical aspects. If you want, you can watch that. That's again an optional thing, otherwise not. One very important video that I want you to actually watch from Nishant's cardiology side. Okay, what I want you to definitely watch from his cardiology side would be the videos on atrial fibrillation. Okay. The videos on acute rheumatic fever, the videos on pulmonary embolism, the videos on coronary artery disease in total, then videos on myocarditis, Takotsubo cardiomyopathy. Okay, these are the extra additional things I want you to watch from Nishant. So, atrial fibrillation, acute rheumatic fever, pulmonary embolism, CAD, myocarditis, Takotsubo. ECG, I think all of you having done your PG, there is nothing big about it. ECG per se, if they ask you also, I don't think you need to waste time learning that. How to approach CAD, ACS, STEMI and NSTEMI, I think Nishant has done in toto. I have done 2 modules on build up to ACS 1 and 2. So, you can watch build up to ACS 1 and 2 and then watch Nishant's CAD videos. AFib, you can directly watch his acute rheumatic fever, pulmonary embolism, myocarditis, Takotsubo, you can watch from there. The rest of the things, you can actually do this. 5-6 days time is more than enough. Okay, if you dissect out the chapters, 5-6 days time, you can finish it off. Okay, so that is basically our idea of cardiology. So must watch videos of Nishant Sagar, I would say, are pulmonary embolism. It is a tremendously good video. One of the best pulmonary embolism videos that I have actually seen my whole life. Second, of course, is infective endocarditis, hypertrophic cardiomyopathy. These are the best videos. Aortic stenosis, mitral regurgitation, again very good. And then of course the others. What essentially he feels that you have to be watching inside that he will come up. I mean, each of these teachers, Mayur, Nishant, etc., are going to come out with few sessions. So inside that they'll be discussing few MCQs and telling you where to focus. But this is in a nutshell what you have to be knowing. So that's about cardio. So from cardio we go to chapter number 3. Chapter number 3 is probably the chapter that I like the most in medicine, as I have told you so many times. That is your liver hepatology. So as far as liver hepatology is concerned, I probably want you to watch only my videos. I think one chapter where I feel so confident and I feel that I know the best, although I'm a nephrologist by profession, I feel I know the best and I'm most confident in is definitely liver and hepatology. So inside liver and hepatology, how you approach the first 2 modules, etc., basics of liver are actually very important. Inside that, special emphasis on how to interpret LFT because it's very important at different levels. Then of course acute hepatitis, especially acute hepatitis A versus E, the differentiation, and also what is acute liver failure, again very important. Chronic hepatitis, including the first comparison, that is hepatitis B virus, hepatitis C virus. Then of course alcohol and NASH, you have a comparison. And then of course this entity called alcoholic hepatitis, which has to be studied in detail. Then of course another comparison, that is Wilson versus hemochromatosis. Okay, Wilson versus hemochromatosis. Another comparison, that is primary biliary cirrhosis versus primary sclerosing cholangitis. Okay, these are the core topics. Then comes cirrhosis. Inside cirrhosis, must watch topics include ascites, and inside that SBP also. Hepatic encephalopathy, hepatorenal syndrome, hepatopulmonary syndrome. Again, very important. These are the things that I actually want you to know. Okay, now what additional things do you want to actually watch from the SS videos? From the SS videos, you have to be watching drug-induced liver injury, what is called DILI. Second is pregnancy and liver disease, again very important. And third, acute and chronic pancreatitis. Okay, acute and chronic pancreatitis. And you should also go and watch a module done by Srikanth. So these videos are done by Dr. Tarun, DILI, pregnancy and acute chronic pancreatitis. You can actually see Dr. Srikanth's video also on UJ and LGI bleed. Okay, that's also an important video. UJ and LGI bleed. This is about it. And I have done a brief video on portal hypertension on basic measurement part, etc. I think that should be enough. That's an advanced video done by Tarun, not mandatory. So I think these many things. Delay pregnancy, acute chronic pancreatitis, UG, eligibility, please to watch from the gastro part. The other things, if you watch from this side, is more than enough. This is an easy chapter. Don't let it go. Don't read Harrison. It is utter complicated and it is basically not giving us any information. So let us not go and read that. From whatever we have discussed so far in endocrine, I told you thyroid is a good read. Cardiology, I have never ever liked the way Harrison has presented the topic. And probably the only part which I did like a little bit is maybe pericardium, etc., where it has been done reasonably well. The other parts have not ever been able to find any kind of sync with. So this is liver. Okay, from liver we go to medical gastroenterology. Medical gastroenterology, from my side, I want you to basically watch the approach videos to diarrhea, the approach video to malabsorption. Inside that, we have covered lots of stuff, lots of tests and how to basic interpret the tests and D-silos and all that. Then this huge comparison question between celiac, Whipple and tropical sprue, which is a very, very important comparison thing, and to study all these things in detail of it. Celiac is a very, 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 very important topic. Inflammatory bowel disease, Crohn's and ulcerative colitis, end to end, very important. I have taken it how we learned from the UG level, from the basics. Very, 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 very important. H. pylori, everything about H. pylori under stomach, and irritable bowel syndrome. Okay, H. pylori, irritable bowel syndrome. From what Srikanth has done under medical gastro videos, what you have to must watch are one, achalasia cardia. Okay, achalasia cardia video is actually done in a bit more detail, but at least try to know the main points. Barrett's esophagus. Okay, Barrett's esophagus is a really good video of his, where he has covered a lot of points inside Barrett's esophagus. Gastrointestinal stromal tumors, not so much in detail, but still you have to be knowing. Clostridium difficile. Okay, another important question. And two videos which Srikanth has done, which are really good. One is obesity and gastrointestinal neuroectodermal tumors. Okay, these are the things. So I took these 2 days time to actually watch all the videos and get a very, very reasonable understanding. I don't want to come in front of you and say, you have to buy this, you have to buy that, and you have to watch this, and everything will come from this. I'm not giving you any such promises. Things may come, may not come. These are basically my opinion. That's it. And you are not small children to actually be feeding. You have your own ideas, you have your own perspectives. So you can just take points from here and there. Ultimately, it's for you to decide. So that's about our chapter number 4, that is medical gastroenterology. From medical gastroenterology, we move to chapter 5, and that is my own science, that is nephrology. So how we approach nephrology. For nephrology, you have 2 sets of videos, right? You have the SS videos that's done by me, and of course the basic videos which are also done by me. So we'll go just try and see. So basic videos are enough for most of the modules. So we start off with the first set, that is nephrology basics. So nephrology basics include anatomy, physiology, urine analysis. So I think for that, the SS medicine videos are more than enough. You don't have to watch any of the specialty videos. Anatomy, physiology, urine analysis, that's more than enough. Then we go to individual compartments in the kidney. Vascular compartment is the first discussion video, again for which a basic medicine discussion, more than enough. Then comes this important module, which is a very, very crucial module in any entrance exam in India. Whether you take it at nephrology SS exam or maybe this medicine side, it's a very, very crucial module. So this glomerulus module, I would strongly recommend you to watch from the SS videos, the SS nephrology videos that I have done. If you can watch the glomerulus videos, I think that will be great. MCD versus FSGS versus membranous nephropathy, that is the first section, which are the podocytopathies. Then of course this big discussion on MPGN, IgA nephropathy, PSGN, and good pasture. So these are the so many hot topics inside this. Alport also. If you don't have time, if you watch it from the medicine videos, that's okay. But I would think that to get an edge, you can probably watch this. Okay, that's the glomerulus side. Then comes AKI, ATN, okay, AKI, ATN, which again the medicine level videos are more than sufficient. If you go to the SS side, you can see a couple of discussions which I would want you to just look into. One is contrast-induced nephropathy, where maybe I think you can get a question. Then of course myeloma and the kidney, okay, and then renal cortical necrosis. So contrast-induced myeloma, renal cortical necrosis, if you want, you can actually watch. And I have also done a module on ATN versus ATIN. So that is also a module which might be conceptually very helpful for you. So ATN versus ATIN, contrast-induced myeloma, cortical necrosis. These are the things that I want you to watch from the SS side. Otherwise, AK general topic more than enough. CKD basic module more than enough. Stress on anemia. Okay, because they often ask questions on that. So stress on anemia. Then hemodialysis and transplant, I have done 2 basic modules which you can just quickly brush through, because in case you get 1 or 2 questions, that's just Harrison level. So hemodialysis and transplant at a basic level, I think should be more than enough. Okay, so vascular, AKI, CKD, dialysis, transplant, everything from the routine medicine videos, the SS medicine videos. These are the topics along with AT and ATI and contrast-induced myeloma, cortical necrosis that I want you to actually watch from the SS videos. The additional topics that I want you to watch from the SS videos are the metabolism videos. The metabolism videos that I want you to watch from SS because they'll definitely give you an edge because metabolism is that part which will get an edge. One, of course, is the acid base where, of course, if you know how to interpret acid base, I think it's more than fine. Tubular disorders is a module that I have done under NEET SS Rheumatology. I think I expect all of you to watch this tubular disorders. Inside this, we discuss the proximal tubule and, of course, so many exchanges that happen, the potassium-based disorders, etc., which I think will be definitely of use, especially RTA, especially hypokalemia, hyperkalemia, both of which are very, very important. So I wanted to watch these tubular disorders. Acid base, basic videos only we have for acid base. I have never done any extraordinary advanced videos on acid base. That is not required at any exam level. That is for a person like me who is passed out nephrology. For an entry level, that's absolutely not required. Basic acid base videos, if you watch, is more than sufficient. Okay, this is about nephrology. From nephrology, when we move to the next chapter, that is rheumatology, chapter 6. Okay, so rheumatology videos, again, I have done the SS part also. That's a bit of an adventure, I guess, because I'm not a rheumatologist, but still I have tried my best to actually do justice to that. When you study rheumatology for this exam, there are again 3 units. The first unit is connective tissue diseases, unit 1 connective tissue disease. Inside this unit 1 connective tissue disease comes this most important topic called SLE. Now, and I want you to watch SLE from the NEET SS rheumatology videos itself because SLE is such an important topic along with SLE antiphospholipid antibody syndrome that comes together. I think apart from that, the rest of the CTD topics, you don't need to watch from NEET SS Rheumatology. You can watch from NEET SS Medicine itself. But never forget scleroderma, sarcoidosis, very, very important. Sjogren syndrome, very important. IgG4, which is there in SS part. Okay, so scleroderma, sarcoidosis, Sjogren syndrome, IgG4. Then, of course, very important, polymyositis, dermatomyositis. Okay, polymyositis, dermatomyositis, of which polymyositis, dermatomyositis, if you have time, please to watch from the SS part because a lot more details have been added to that. Original discussion that you see in the medicine part is a basic one. I wanted to discuss wanted to know polymyositis, dermatomyositis in detail because it comes in neurology also, it comes in rheumatology also, it comes under muscle. It's a very important integrated topic. You get a lot of MCQs with respect to that. So polymyositis, dermatomyositis, if you can watch from NEET SS would be good. SLE, APS, I wanted to definitely watch from NEET SS itself. NEET SS Rheumatology, I mean. The others you can watch from NEET SS Medicine. That is more than enough. Okay, when we go to second unit, that is arthritis unit. Rheumatoid arthritis is again one topic which I want you to watch from NEET SS Rheumatology because it has been done in detail, and if you get a question on arthritis, it's most likely to be from rheumatoid arthritis. And from the NEET SS Medicine part, I want you to watch 2 units. One is seronegative spondyloarthropathies, inside which focus maximum on ankylosing spondylitis, and second, crystal arthropathies, inside which focus on gout and pseudo gout, of course. Okay, and monoarthritis, inside which you have to focus on one single topic, that is septic arthritis. Okay, septic arthritis and juvenile idiopathic arthritis, JIA. It's a very important topic. Please learn it from NEET SS Rheumat. So what you have to watch from NEET SS Rheumat would be SLE, APS, rheumatoid arthritis, juvenile idiopathic arthritis. Okay, and the other topics, if you watch from medicine, is more than enough. But each of these topics is very important. Rheumatology is again one area where NAT board is definitely going to ask you a lot of questions. Unit 3 is vasculitis. Vasculitis, please do watch from the SS videos. I have done vasculitis in great detail. Vasculitis is a fascinating topic for any medicine person. If you ask any medicine HOD to set up the question paper, they will ask you questions on vasculitis. Harrison's discussion on vasculitis is not up to the mark. It's a very mediocre level discussion. So we have taken it one step forward. I want you to discuss vasculitis. I want you to learn vasculitis from NEET SS Rheumat itself, and inside that have special focus on ANCA vasculitis. A very, very important topic. Special focus on ANCA vasculitis, special focus on Takayasu, and special focus on giant cell arteritis. Please. If you don't have time, you can watch from medicine videos, but it doesn't make much of a difference, man. If you watch from SS, you can take that extra bit of time, but there will be definitely more clarity. Okay, that's it. Chapter 7 is clinical immunology. When you have an exit level syllabus, you're not going to get any questions on clinical immunology. I personally don't feel. If you want to be very sure, I think you can watch that one single module that is on primary immunodeficiencies. In case you get some question on clinical immunology, that is going to be from primary immunodeficiencies. Primary immunodeficiencies I have done under Immunology SS. So under Immunology SS, you can watch the single module. The other modules you can actually skip. Okay, so that is about rheumatology immunology. From rheumatology immunology, we go to chapter number 8. And chapter number 8 is the biggest of the chapters after endocrine, and that is neurology. And neurology, I think people who have been preparing for neurology would be knowing how well Bashek has done the videos and how conceptual it is and how much he actually brings you or takes you alongside with him. Let us try to see how to approach neurology. The basic videos starting off with headache, you can actually watch from medicine and just stop it. It's very simple. The first module on headache is more than enough. Neurocutaneous syndromes is the next one, which again I think I have done in detail. You don't have to actually waste your time watching anything more. So headache, neurocutaneous syndromes. Neuromuscular junction videos also I think I have done in reasonable detail. I think one step above Harrison. I think that will be more than sufficient. Then comes myopathy videos. So under this myopathy videos, I have done basic approach to muscle alongside with inflammatory muscle disorder under rheumatology and approach to all these individual muscular disorders and stuff. Inside this, I wanted to watch NEET SS Neuro video. Inside NEET SS Neuro video, you can actually see Duchenne, Becker, and such dystrophies being discussed, including myotonic dystrophy being discussed by Bashek in one single module. So that module is very, very important. The myotonic dystrophy, Duchenne, Becker dystrophy that he has discussed. Then when it comes to nerve, peripheral neuropathy, I have done a module on inherited versus acquired peripheral neuropathy. So that is an important module where you will actually get an idea on this approach and how inherited versus acquired, etc. And then you have to go back and watch GBS and CIDP. GBS and CIDP, I personally want you to watch Bashek's module. They're very well discussed and you get a better idea on how to actually approach things. Okay, then motor neuron disease. I think motor neuron disease, I myself, I think I've done at a reasonably good level. I think that should be enough. And epilepsy. Epilepsy also medicine level discussion would be more than enough. Then when you go to lobar, I wanted to study aphasia and dementia. And inside that, again, watch Bashek's videos on Alzheimer's disease, which is very, very, very important. Multiple sclerosis as such, I think you can skip. It's not that very important. Optic neuritis and INO, there is a module done by Bashek. So optic neuritis and INO is a module done by Bashek under NEET SS Neuro. Please watch that. Then Parkinson's disease and PD plus syndromes. Again, I think medicine level discussion is more than enough. Meningitis, again, bacterial versus viral versus TB. Again, I have done under infection. That should be sufficing. Compressive versus non-compressive myelopathy. Okay, compressive versus non-compressive myelopathy. Please again watch that from medicine. I think that should be enough. What I wanted to strongly watch from NEET SS Neurology videos done by Dr. Bashek are one, stroke in detail, okay, because he has done terrific videos on acute stroke management, terrific videos on brainstem strokes. They're excellent videos, okay. I think it will be really of use to you, not just for the exam, but in toto, it will be really good. I want you to watch his videos on approach to ataxia, which will again completely change your perspective on ataxia and it will be very important for exam because Harrison's also done a discussion on ataxia. Harrison's one very good chapter is neurology. Obviously, I think all of you would have read. If you ask me, among the different chapters that Harrison has tried to write, the one that he has succeeded the most is neurology. If you look at most of the other chapters, they don't kind of generate any interest in the person reading the book per se. But neurology is one chapter where he's done an excellent job and hats off. So stroke, approach to ataxia, brainstem syndromes, optic neuritis, INO, Alzheimer's disease, GBS, CIDP. These are the things that I want you to watch from NEET SS Neurology part. Apart from that, NEET SS Medicine part, headache, neurocutaneous syndromes, NMJ, approach to myopathy, approach to neuropathy, peripheral, inherited versus acquired, MND, epilepsy, especially the classification, bacterial, viral, TB, meningitis comparison, compressive, non-compressive myelopathy comparison, lobar, lobe-wise you don't have to know, but basics, aphasia, very, very important, dementia, very important, and also small things inside that lobe. Like for example, we discussed what is apraxia, what is agnosia. Those things you may get a question, isn't it? Constructional apraxia, a non-dominant parietal lobe, like that's the kind of question you may actually get. Okay, so this is in toto, neurology. And I think you will fall in love with neurology once you watch stroke videos, etc. They are really, really good. So that is neuro. We go to chapter number 9. And that is respiratory system. So we are actually in the process of starting the respiratory shoot. So we are having Dr. Vishwesh who is coming from Hyderabad. He's the person who's supposed to, but the videos are not out as yet. So respiratory, I think you will have to stick on with medicine. So I wanted to actually start with lung physiology because in that lung physiology video, we have done a lot of basic stuff, which is important for you to understand PFT. And in case they ask you flow volume loop is not a must, but PFT interpretation is a must. Okay, then COPD versus bronchial asthma, where I have tried to discuss the GOLD and GINA guidelines, just like that, how it is managed per se. ABPA, very, very important, allergic bronchopulmonary aspergillosis, always comparing it with hypersensitivity pneumonitis and bronchiectasis. So these three things you have to always study together. Critical care, respiratory, that is ARDS and respiratory failure, that is the next comparison. Vascular disorders, pulmonary hypertension, pulmonary embolism you can study from cardiology. Then ILD, very, very important in toto, please study. Versus occupational disorders, including asbestosis and silicosis. Pleura, a very short module that I have done on pleura, and sleep, a very short module that I have done on sleep. These are the things that you have to study, and everything about tuberculosis. Where tuberculosis stands today, etc. We have done a separate module, the management part and how it has changed those things. This would essentially be it. Never attempt reading respiratory system from Harrison, is utter crap. Okay, so never attempt reading. This is more than enough. Because some people, see, when you join as a postgraduate student, the feeling that you have, and many people actually try to fit it into your system, that the ultimate aim of a medicine postgraduate is to finish reading Harrison. And once you finish reading Harrison, you are on top of your game. Absolutely no. I am basically a person who had read most of this book entering inside itself. So I know that there's of no use in teaching someone, it is of no use in treating someone. It's just to actually show off your knowledge in front of others. That is the knowledge, that is the plus that I have basically felt. If you are a person who feels that showing off is important. Okay, that is about respiratory. From respiratory, we move to the another chapter, that is blood disorders. Very, very important chapter, and you get a lot of questions on this. Hematology, I think many of you may be even preparing for hematology. We are also in the process of making hematology videos. We started shoot only, so they are not released as yet. As far as hematology videos are concerned, I think I have done a relatively good job, I feel. Covered almost most of the things. So starting off with RBC disorders, where I want you to watch the basic module on hypoproliferative anemia, then microcytic anemia, then macrocytic anemia. These are the three basic videos. Then of course hemolytic anemia. Under hemolytic anemia, your immune hemolysis and your non-immune hemolysis. And under non-immune hemolysis, very important, PNH and fragmentation hemolysis. Okay, all these things are very, very, very important. Myeloproliferative neoplasms, bone marrow failure syndromes. Okay, all this you can actually finish in no time. Just 1 hour you can actually watch this and you can make your notes and finish it up. If you have your notes, just write on top of it, that's it. So bone marrow failure syndromes. Okay, as far as WBC goes, plasma cell disorders, very, very important. Hodgkin's disease, non-Hodgkin's lymphoma, and of course the tried and tested questions on AML, ALL, CML, CLL. Okay, this you can actually watch in one go. Platelet, if you don't have time, you can skip. At the most, if you want to watch, I would recommend you watching thrombocytopenia, von Willebrand disease, hemophilia, and DIC. Okay, von Willebrand disease, hemophilia, DIC. Okay, and hematology is also a chapter that has been written reasonably well in Harrison. Though it's not that updated, it's reasonably well written. And my videos, I think, are the most updated videos where I have tried to go in depth and discuss. Okay, in fact, I am a person who wanted to do hematology SS videos by myself, but I know that knowledge is not up to the mark probably because it's a lot to do with transplant and stuff, which I'm not a person to talk on. But it's a really fascinating subject, one of the most fascinating subjects in the entire medicine that we have with us. So this is about hematology. And lastly, infectious disease. So as far as infectious disease is concerned, there is a lot of confusion among students because this whole Harrison is full about infectious diseases. It is not practical to read and nobody's going to ask you word by word like that. They should be, somebody who's lost his senses to be asking like that. So we'll be conducting MCQ exams. I'll come to that. So inside that, we'll be just hinting upon the important areas. So as far as infections is concerned, infective endocarditis from cardiology, must. Community acquired pneumonia, I have done a separate module. Please do watch that in immunocompetent and immunocompromised host. Meningitis, again, I have done my videos in that. HIV, I wanted to watch part 1 and part 2. Okay, then infections of the kidney, including urinary tract infection, which we have done in detail. TB, I told you, alongside with the respiratory system. And a short note that I have done on tropical infections. I think I have not gone into in-depth analysis like what Harrison does. We have to be actually knowing what the state of art. What is the point in me talking about Vidal when I know that Vidal is an obsolete test? There is no point in doing like that. So we are not doing those things. So whatever we are doing, how we manage a patient and what idea we have, that's it. And please do watch the COVID-19 videos, which are also uploaded in the app. So the updated COVID-19 videos are just released. So you can actually watch those updated COVID-19 videos also. Tropical infections, TB, kidney, HIV, meningitis, CF, and community acquired pneumonia and infective endocarditis. This would be in total the 11 chapters that we have with this. We have quite a lot of miscellaneous topics which I'm just kind of collecting and I'm trying to do a video on that. So what is Marrow's plan basically? So you have this SS plan with you. You know how to study with this. This is more than what you can actually do in the next 2.5 months. You have to be on top of your game to finish this much. Now alongside with that, you'll be having test series. So there'll be two kinds of tests. Okay, one will be the 150 question based basic test, which is not on one single chapter. Okay, it'll be a mix. 150 questions we'll try to take from Harrison, Goldman and Cecil are the two major textbooks in medicine anywhere you go. So either they go for Harrison or they go for Goldman and Cecil, and then of course CMDT. These are the three textbooks. So we'll just kind of go through everything and mostly focus on Harrison and try to pick up one-liners which we feel may come for the exam and make questions out of this. So every week you'll be having this going. Then you'll be having subspecialty based MCQ discussions, which will be done by the individual faculties. I'll do nephrology, Nishant will do cardiology, Bashik will do neurology, like that. So wherein we'll be having 40-50 questions. We'll just upload it, wait for 2-3 days, and then we'll come back and discuss those things, which are also going to be at a PG exit level, not very higher end. At that point in time, the subspecialty consultant will actually discuss with you, not consultant, teacher will actually discuss with you what he or she thinks is most important. So we will actually, then you can actually watch those modules. But I have told you from the SS videos what to watch, from the medicine videos what to watch. And once you have this much of knowledge, you are going to get rank 1 in the country. There's no doubt about it. And I can very confidently tell you that because I have got rank 1 in multiple places, because then there were so many exams. I've got rank 1 in so many places. Nishant was also rank 1 in cardiology in that particular year. So I think we can very well talk on that. And DNB exam also I told you was rank 2. So that was conducted by the NAT board. So we have enough confidence in that way. But I'm not trying to tell you that this will come or this has to come or you have to take this, etc. You are the person to decide. You are having so many things with you. How to go about with preparation is purely your prerogative and you do not ask anyone about it. This is what I think we have got to offer for you. And we'll be conducting exams. One, these kind of exams, and then subspecialty. Live sessions, we'll try to do a few in between, and we'll try to keep you as active as possible. And I think it depends on the individual person. Because for me, when I prepare, I basically don't like listening to anyone. I have my own plans. I try to execute those plans. But there are others, many of you right now, who are like kind of shocked because suddenly there is a shift and suddenly there is something like a new syllabus or a new pattern, and many of you may be preparing your subject for so much of time. But just take it in a very chill mode, because after MBBS, doing MD is a necessity. Okay, it is 100% necessity. Whereas after MD, doing DM is a choice. This choice may work or may not work also, because after you finish DM, then you are a consultant. There are already enough and more neurologists, there are already enough and more nephrologists. To compete and fight with them and come forward is not an easy task. And many of them are so much skill-based. So to have enough skill to fight, to compete and to come forward in a subject where everybody studies the same thing is not at all easy. Okay, it's very, very hectic. So you are coming to it knowing that it is not easy. So obviously the exam part is the easiest out of it, I feel. So if you've not studied medicine so far, let me just tell you, just take it very chill. Anyway, you have done your MD in medicine. You just go and watch the videos. I think that should suffice. And if you're a pediatric person who is now finding it difficult, cases are going on, but still if you feel that it's difficult for you, that, I mean, obviously it's injustice to be actually asking you to study a subject which you have not done as your primary course. But I think, again, I'm telling you, with your basic house agency knowledge, if you watch these videos, you are still very much in the race. Okay. And I feel the difficulty level is going to be like almost 90, 60, 90 is going to be basic, 60 is going to be tough. But I think our videos, along with the specialty videos that I have hinted on, if you watch, you should be in reasonably good shape. So, no time to waste talking crap here and there. Just sit and study, focus hard. There are still about, I think, 65-70 days. With that, you should be able to complete this. If you complete this, you are in with a very, very solid chance. If you're working somewhere, just throw the job away and sit and study, because there are so many others who are sitting and studying. So it's not practical to do a job and study. It's not easy to do two things at the same time. So just throw all that away and sit and study till November 15, number 13, 14, and hopefully you get the results. I'll again come back to you with the MCQ discussion videos. So I'll be just trying to focus on areas which you may leave. So please don't take Harrison and start reading. Please, please, please don't do that. That will not take you anywhere. So stick to a platform and then try and listen to what those people have to say over there, like as in Marrow or any other platform for that matter, and then go with that plan, stick on to that plan and start finishing the videos one by one in the chapter order, whichever way you want. But this is the order which I feel is the best. And I think in 3-4 days time, you can finish a chapter and keep moving on. So all the best, guys. And hopefully this video was of use to you. Thank you so much.